You know, a theme of what you've been mentioning is just how difficult it has become to work with a lot of members just because of the political toxicity on different issues. You, of course, you've mentioned several Democrats that you work with. I do want to pivot to look at COVID because that is a place where, when it comes to response, you have been working with fellow Democrats to try and get more help to your state, which has just been constantly seeing new cases, a rise of new cases in Michigan. When you talk about needing more resources, yesterday over on the Senate side, a number of Republicans were saying, I don't want to support the government funding bill, which tends to not, it has become more political, I should say. It used to not really be that big of an issue. But they said that they weren't going to support it because they wanted to vote and make sure that, vaccine mandates, that there's all these different mandates aren't put in place. Is that helpful? Because even so, that amendment failed. It's still kind of the position of the party saying, we shouldn't have all of these mandates. We shouldn't necessarily, I don't know, it could be going against what you're asking for, just more resources here and there in your own state and help from the federal government.
Yeah, well, a couple of things. First of all, I'm gonna just go back a step. Our delegation generally works pretty well together. I mean, whether it's protecting the Great Lakes, when we started COVID, we all worked together, Republicans and Democrats, trying to get more PPE, personal protection equipment. I mean, all of that. We had a lot of conference calls, and tragically, Michigan now is one of the worst states with these new incidences. I talk to my health providers myself every week. I get a count. I get a daily count from the counties that I represent of the people that are vaccinated, first dose, second dose, and we're working on now seeing who's been boosted. A lot of this has to be on the education side. When we did the 21st Century Cures bill, that was my big bill when I chaired Energy and Commerce. We expedited 21st Century Cures expedited the approvals of drugs and devices, coupled with $45 billion more in NIH funding, research funds. And that went back to my early days when Newt Gingrich had pegged me as the lead Republican with John McCain to double the money for the NIH. We passed that bill. We passed the 21st Century Cures bill, 392 to 26. Is literally the last bill that President Obama signed into law. And because we did that, we were able to see Pfizer, Moderna, J&J actually get their emergency use authorizations and production of the vaccine months early, maybe 8 to 10 months earlier than it otherwise would have been, which, as we know, saved hundreds of thousands of Americans because we were able to do that. But we have to do a better education effort. I looked at my numbers again this morning for my counties back home. I think we have maybe 2 counties that are over 50% in terms of getting that, let alone where the booster is. When I talked to some of my hospital administrators earlier this week, it's like 90% of the folks in the hospital, almost 100% on ventilators, weren't vaccinated. I mean, the evidence seems pretty apparent, but we have to do a better job of educating folks to let people know what happened. Now, there was an early problem with the vaccine. And we correct this. We've now introduced Diana DeGette, who's been my partner on 21st Century Cures. We've now introduced HR 6000 just in the last week or so, and we're calling it Cures 2.0. But one of the things that it does, it requires, when you do these drug trials, you got to make sure that minorities are included to make sure that the diversity issue is well represented. That wasn't the case, I think, in the COVID vaccine trials, and as a consequence, particularly folks of color were petrified about getting that shot, and I think we've done a lot to correct it. Again, I look at shots in my minority districts, and it seems like they're doing a little better than other areas in my district and around the state. But we correct that in Cures 2.0. But I've not been one to mandate a vaccine. I think we have to do a better job of educating folks, and particularly now with this new variant that's out there, again, listening to the news this morning, I think it's perhaps 3 times more contagious. We don't know yet whether it's more deadly or not. We'll know in the next couple of weeks. But we have to share that evidence and let people know what the consequences are, and make sure that we have the availability of that booster shot, and to make sure that people get their first and second ones if they haven't gotten them.